Hi, this is Dr. Jennie Byrne. I'm a psychiatrist. I have a private practice here in Chapel Hill, North Carolina. And today I just want to speak briefly about a medication called Naltrexone. I get a lot of questions about Naltrexone, what it is, and what's the difference between Naltrexone and another medication called Suboxone. So Naltrexone is a medication that can be used in the treatment of opiate dependence, which is when your body is addicted or dependent upon an opiate medication, things like oxycodone, Opana, Percocet, even heroin. And Naltrexone is a medication you can take if you're trying to get off of those medications. And what Naltrexone does is it blocks opiate receptors in the body. So if you take the Naltrexone, if you can kind of imagine the receptors in the brain like a little cup, and Naltrexone floats around. It's a chemical, and it jumps on those receptors and it blocks them. So say you took your Naltrexone medication in the morning and then you had a sudden urge or impulse to take some pain medication, your receptor would be blocked. So another chemical floating around here couldn't get on the receptor because it would be blocked with the Naltrexone. So Naltrexone can be very helpful for people who don't have problems with physical withdrawal. Physical withdrawal is when you get off opiates and you have a lot of physical symptoms, feeling restless, can't sleep, hot and cold, stomach cramps, diarrhea. If you don't have those symptoms, Naltrexone can be a really good option for you. One of the downsides of Naltrexone is it does not treat the physical withdrawal symptoms. So if you're someone that's been trying to get off pain pills but you have a lot of physical symptoms, Naltrexone probably isn't going to help with those. So the pros of Naltrexone are you can take it, your body's not dependent upon it, you don't tend to have any side effects with it. It blocks kind of that impulsive desire to use, but the downside is it doesn't really take away any of the physical withdrawal. Now to compare that to Suboxone, Suboxone is a medicine that has buprenorphine and naloxone in it together, and Suboxone will treat both the impulse to use because it also blocks receptors, but since it opens those receptors a little, it also treats the physical withdrawal symptoms. So if you're someone that's having a lot of trouble with physical withdrawal, like you're so sick you can't go to work, something like Suboxone may be a better option for you. And just to kind of add that, just because you've done Suboxone, maybe Naltrexone is a good option for you after you've done a Suboxone program. So say you did the Suboxone program, you tapered off, you're not having physical withdrawal, but you're still maybe concerned that you might relapse. Maybe you're concerned that you're impulsive and that if you're around the stuff you might tend to pick it up. Naltrexone can be used after you're finished your Suboxone to kind of avoid those impulses and keep you on the right track. Naltrexone can be taken orally with a pill once a day, or it actually has a shot version that you can get once a month. So say you're someone you've gone through a good substance abuse program, detox rehab, or Suboxone, but now you're worried about impulsive use. You could get a shot of Naltrexone once a month. Some people really like this option. So just wanted to tell you a little bit about this medication because I do get questions about it. If you have any more questions, please feel free to contact me at the information below and I'd be happy to help. Thanks.